My name is Corey Creech, and I would like to share my proposal for reducing persistent opiate use after surgery through standardized guidelines. Persistent opiate use is a growing postoperative complication, not just in the US, not just in Southern California, but worldwide. Even brief exposure can lead to long-term dependence, misuse, or abuse. As nurses are the primary caregivers in a clinical setting, it's our responsibility to conduct pain assessment, to provide patient education, to properly administer medication, and to also seek alternative pain therapy. This study, this review of 22 studies from Gong and Associates shows that across cultures, across countries, there is a 3.9 to 14% um, rate of opiate naive patients developing long-term opiate use. This study out of Austria shows that 500,000 patients, 1.7% developed long-term opiate medication abuse, with the majority of those following spinal surgery. And this study from Germany that followed 200,000 patients found a 1.4% of their population developed long-term abuse, with the majority of them having history of alcohol abuse or having antidepressant medication. There is variation across country, there is variation across cultures. However, this is a growing problem worldwide. And using stewardship practices for the medication, having the patients turn in excess medication beyond their need for it, has shown to reduce the risk of addiction from 11% to 6%. A lot of the challenges that we face are inconsistencies in what the doctor prescribes. Now, a guideline would help, I think, to stop overprescription, minimize the length of time that individuals are on these medications, only use it for the most acute pain instead of for, long-term pain management. So the first step on this would be to form an interdisciplinary team, anesthesiologists, doctors, surgeons, nurses, and have them review the current literature regarding pain medication, and to make a rough guideline, um, that education being targeted particularly towards nurses and prescribers, making sure that they understand what the study is for, what the guidelines are for, and uh, the overarching idea of what we're trying to do. Potential barriers would be prescribers being resistant to change. Um, saying that they've always prescribed their medication this way. These are the metrics that they've always used. Who says that the ones that we're providing are any better? Individuals being ignorant of alternative pain therapies, and what the patient expects, whether they expect their pain to be a zero until they're better, or if they expect to experience some pain after a surgery. A new persistent opioid use is defined as opiate, pres- opiate prescriptions being filled between 90 and 180 days postoperatively. To collect the data, that we could tell whether or not the guidelines are working, is we would get the information we need from the electronic health record, through pharmacy refills and through nursing documentation. And the ethical considerations would be to protect patient confidentiality, ensure adequate pain control, even if we are trying to limit the amount of pain medication prescribed. Um, an emphasis on different pain management therapies and making sure that we have institutional approval. The expected outcomes would be to reduce the number of opiates prescribed after surgery, lower the overall post-operative exposure, and decrease the instances of new persistent opiate use. Nurses would better be prepared for advocating for their patients for safe pain management, um, and for educating their patients. Promoting a culture of safety and evidence-based practice um, is one of the biggest priorities we have as nurses, just ensuring long-term um, success for our patients, improving post-operative patient outcomes, strengthening the nurse's role, and contributing to long-term improvements in surgical care. Persistent opioid use after surgery is a preventable complication and a threat to patient safety and outcomes. And it's something that we all can take part in. It's something that we all can advocate for our patients. And guidelines like this have been proven to work in the past. And if they can be implemented um, on a nationwide scale or on a worldwide scale, I'd be out of a job. Working at a drug and alcohol rehab, the majority of my patients are um, struggling with opiate addiction, and seeing them withdraw every day um, is what gave me the idea for this project. And knowing that a lot of them came from backgrounds with limited medical knowledge and no family history of addiction, seeing my residents like this really is heartbreaking, and it is something preventable. Thank you for your time, and I hope you have a good night.